It's a big failure, it's a big void, and a big need for education. There is just no emphasis, no speaking of, no proper information out there for women to say, beyond reproductive age, this is what women go through.
This is what we should expect.
And a starting point to say menopause is normal. It's a phenomenon in a woman's life. However, it comes with big challenges for certain women. And this is what is normal. And depending if you are struggling, you see, from a science point of view, being menopausal isn't the problem. Having menopause and having problems with menopause is the problem. That's what should be managed. I always say, if someone walks in and says, I'm this age, or I don't have periods, I don't really have an issue, but I need something because now I'm menopausal. And I ask them, so what are you struggling with? What is the problem? If you don't have a problem, just like some girls sail through puberty, they don't know what a period pain is, they don't know any issue, they just, then you don't need a problem. But majority of women do. But very few women ask for help or even know that they can ask for help because they haven't been told. It's a big failure for me in the medical fraternity that women aren't ignored, and then everything gets labeled as, oh, it's your hormones, and just pushed aside as if it's a put on show, it will pass, and women struggle.
Right.
Sometimes too long, and problems pile up. For example, besides a change in bleeding pattern, that's what women look at, from having spaced out irregularity. Over the age of 40, there can be irregularity, which can be part of transition, but irregularity, which can be problematic, not part of menopause, and which can be an indicator for serious, sinister problems that will happen. And the worry is always this cancer risk of sorts. The symptoms of hot flushes, night sweats, mood, and all of that, most people become aware of them. And that needs to be a discussion if you're not coping, if it's affecting your quality of life, that needs to be managed. Because at that age, most women have careers, have jobs, have families, have responsibilities, have challenging. They're undergoing a difficult balancing act, and they still must be themselves, And I mean, lifespan of people is longer. People tend to live healthier. So this woman at 40 is probably maybe is going to live another 30, 35 years. But what quality of the rest of that 30, 35 years is it going to be if they're not equipped to know if this happens and you're struggling, this is the route you take. These are the steps you can take. This is what you can do.
And this is what's available.
And this is what's available. So that is not out there. But unfortunately, what we have is very sketchy, all over the place information, which is not really coordinated and very contradictory and very unhelpful and almost pulling at each other. The one thing is painted as being the horrible, terrible, dangerous, and things that is easy, risk-free. So the information is there, is very mixed. It's a terrible pot of mix, which is really not helpful to women this day and age.
Yes. No, we need more direction.
Yeah. Women who are economically at a disadvantage, who don't have the money, get restrictions or basically cannot get the help they need. But also it goes back to socially, a lot of women who are economically at a disadvantage, the have-nots, don't even have the platform, and they don't even have the socialization to even speak about these things. And
maybe
discuss.
not even realize what's going on.
Because nobody speaks about them, grandmother just grit the teeth and went through it. Nobody spoke about, menopause. They just had to push through, So you find women suffer in silence. They don't know what is going on. But I would like to believe at this day and age, even women who are in remote, rural, economically disadvantaged are starting to at least communicate with their peers where they are, and slowly talking about there is this thing, what one woman is experiencing. And those women, their port of call would be to go to public clinics and public hospitals, public healthcare, to get assisted. And in our systems are very extreme. In the private sector, almost people can get everything and anything if you have the money, and all options are available to those women. Women who are less fortunate to have that are at the mercy of the clinics. The first port of call would be obviously, just like women go for contraceptive in a local clinic, there should be in a clinic qualified staff, clinical medical staff, nurses and so on, who can advise women, who can direct women, and refer women to a higher level if there isn't availability, which is the case. You generally will not be finding hormone therapy stocked up in local clinics, because there needs to be someone who manages it, who prescribes it for women. It is my opinion that we definitely have cultural differences, and even within cultural differences, there'll be regional differences. As I said to you, it's a socialization. In certain cultures, it's not something that's talked about. Maybe older women will talk to younger women, or nobody spoke to them, so they actually can't pass the information and how they navigated, what their experience was. There's definitely cultural differences of what's handled and how you cope, how it's managed, and we just mentioned the hormone therapy and bioidentical hormones, but we didn't really mention the non-hormonal options of treatment. You find in some cultures there are plant-based options that women have always then taken when a woman is at that stage. Some women, that information is passed on. There are things that get used, black cosh, flax seeds, and lentils combination, soya-based stuff, or plant which contain phytoestrogen.
Yes.
So a lot of women have used those things, and you find maybe in that group of women where they don't have access to, they know what plant, what to use, what to take, what dietary adjustment to actually do to help. And those things do help some women. May not maybe eliminate or completely treat them as much as hormone therapy or bioidenticals do, but it makes a difference. And for some women, that's enough, because the degree of struggling with the symptoms is different for women. For some, it's just the need for it to be bearable, the quality of life to be manageable, So from that point, and culturally is obviously how easily the information, even the women to ask how comfortable are they feeling, and you find there's interreligious differences within certain cultures.
For sure.
It's not a discussion that a mother can have with a daughter, a grandmother, and so on. But I would like to believe the world is changing, and more women are realizing that self-care and looking for information, asking questions is okay. A key prerequisite before menopause is be at your healthiest. By healthiest, I mean being healthy physically, taking care of whatever conditions you already have before you get to menopause. Have them under control, because they contribute, and limit your options there. What help you can get. Sometimes it stops what everybody can get because you now have this condition and it's not well controlled. Be a good weight. You know, it's funny, women, we think when you're younger, in your 20s, 30s, being a good weight for your height is about aesthetics, it's about looks. Women must now know it's about your health the rest of your life.
Correct.
If you want to have a good run at life. It's not about fitting into a specific outfit or bikini, or it's beyond that. It's so that your body can then help you when you at the times where your body is struggling through things which will happen because they just will happen. It's a matter of time.
To be able to handle that transition.
Handle better.
Yes.
You know, and women that are extremes don't help. Women that are ultra underweight, they're going to have problems. There's a set of problems that come with them being perimenopausal, menopausal, including ending up with early menopause, and being that women that are overweight, and the more overweight they are, they really struggle, including hormonal related issues by the extra weight and amount of fat they carry and conditions that will come with that. So, and then mentally being healthy, that's important, because women in their 40s have a lot on their plates. And if you're someone who already has, you know, mental issues, you certainly will struggle even more than someone who's just struggling with menopause and everything else, you know. Because with menopause comes the mood change, you know. So already, if you already are struggling. So for me, the message would be you need to strive from young age, early age, your reproductive ages. Your focus should be your healthiest, and your healthiest as an individual. You know, that's why I specifically for you, for your height, for your body shape. Because what happens, a lot of women, for example, with weight, struggle that, but I eat the same, I do the same thing. What does happen when women get older, you expand energy far less. So if you find you have to be so strict in what you eat in menopause and so active, expand enough energy just to maintain, not even to lose. And you lose a lot of muscle mass, which becomes fat. And where the fat goes, it goes in very funny places. And that's an age thing. And a lot of women, the changing body image, which affect your mental well-being because of how you see yourself, how the world sees yourself, how their family, your friends, your partner, your husband sees you, plays a big part. And then if your functionality is also out the window, you know, then women struggle. So I think from an early age, we need to go back and say, young girls, we're not just wanting them to be fit just for sports at school, just to do certain things, which we know by high school, a lot of those girls stop doing those sport things because now they are all girly, you know.
And they're embarrassed.
They don't want to be, you know, except the ones who choose the athletic and are gifted, you know, those are the only ones who will in late high school be doing those things. In varsity, they don't have time. They have time for everything else. And for me, I always say, it doesn't mean people must go join gyms, and no, not at all. You need to be active, and an activity that you will do lifelong. So it's got to be something you enjoy. You need to incorporate mental wellness, physical wellness, eating, not because you're going on some program for a couple of months to fit into some dress or for a short-term goal. Those things should really be long-term goals, lifelong. Women who do far better, not to say they're not going to have issues, they're not going to have challenges in the perimenopause, menopause, are women who've consciously, from early on, been conscious of how they eat, how they look after themselves, physically, mentally, as much as possible.